Hi, my name is John Pierce, and today I would like to talk to you about some of the symptoms and long-term effects of a commonly misdiagnosed medical condition called atrial fibrillation. Misdiagnosed or undiagnosed atrial fibrillation, or AFib, can lead to a plethora of other related medical issues that can significantly impact the quality of life for those who struggle with the condition. So what is AFib? There are 4 chambers to the human heart. 2 upper chambers called the atrial chambers, and 2 lower chambers called the ventricular chambers. Each beat of the heart begins as an electrical impulse. Atrial fibrillation, according to the Mayo Clinic, is a condition that occurs when this normal electrical impulse is interrupted by errant signals that cause the heart to beat out of its normal rhythm of 60 to 100 beats per minute to 100 to 175 beats per minute, and causes the destabilization of the synchronization between the atrial and ventricular chambers, so that the heart loses its normal rhythmic pace and begins to quiver. Normally, this rhythmic signal originates through a group of cells called the sinoatrial node that's located in the upper right atrium. According to a 1997 study, a 1997 NOVA presentation, this sinoatrial node is responsible for, over the span of a human life, the firing of this impulse 2.5 billion times. So this sinoatrial node, or the SA node, fires what's called the atrioventricular impulse, prompting the beating of the heart, or the contractions of the atrial chambers. This impulse follows down to a pathway to another node called the atrioventricular node. The atrioventricular node is responsible for regulating the voltage and the timing of the electrical impulse so that it maintains the rhythm between the atrial and ventricular chambers, subsequently maintaining the rhythm of the heart. When in the condition of AFib, these electrical impulses do not originate in this sinoatrial node. They come from other short-circuited pathways of the heart in the atrium or in the pulmonary veins. When AFib has been properly diagnosed, these pathways, these errant pathways where these signals come from, can be mapped out and surgically removed through a medical procedure called catheter ablation. According to the Franklin Cardiovascular Center, overall success rate for catheter ablation is 85 to 95%. However, Angela Finlay of newlifeoutlook.org says that despite the complete predictability of AFib, we know what it is, we know how to test for it, because the symptoms are so vague, it is difficult to diagnose. I struggled with AFib for over 3 years, misdiagnosed with anxiety and high blood pressure, on medications that constantly changed but never saw the symptoms brought under control until recently. With a blood pressure of 256 over 168, I was rushed to the hospital from work in an ambulance, and laying there in the EI in this tangled web of electric wires, listening to this chaotic beat of the monitor and watching these up and down patterns on the screen that looked more like a seismograph in an earthquake. An attendant tapped me on the shoulder and said, "Okay, we're going to stop and restart your heart." And they injected this chemical in my mouth. And I laid there. Nobody can prepare you for those words. And I laid there thinking about my family and my children, praying to God to live. And then I tasted that taste in my mouth. And then the monitor fell silent. And the pounding in my heart quit beating. Time stood still. And then in the blink of an eye, the sounds returned on the monitor, but it was just as chaotic as ever. I was still in AFib. And then somebody said, "Okay, again." And then once again, I tasted that dry, pungent chemical in my mouth, and the smell of antiseptic hung in the air. And then finally, this rhythmic pace returned to the monitor, the sound of a normal blip, and the up and down signals on the screen looked like something that you would think was a normal heartbeat. Strangely enough, I couldn't feel my heartbeat, but that stress and that anxiety that was there when I came into the ER was gone. I would go on to repeat this process in 2 other emergency trips to the hospital before the ablation surgery that I had and the embedding of a medical device in my chest, an RFID device that maintains or actually keeps track of the rhythm of my heart and uploads that to my cardiologist. According to Johns Hopkins, 2.7 million Americans are diagnosed with atrial fibrillation each year, but many will continue to go undiagnosed. An American Heart Association report said that of those diagnosed, 30% will go on to have an instance of stroke. In a world where more and more emphasis is put on electronic diagnosis, a Seattle Times report indicates a significant number of increase in the number of overlooked long-term illnesses and an increase of symptomatic treatment. Of the symptoms of atrial fibrillation, Dr. Hugh Calkins of Johns Hopkins Hospital lists the following symptoms: palpitations, weakness, fatigue, dizziness, shortness of breath, chest pain, confusion, inability to recollect, memory loss, anxiety, high blood pressure, sleep apnea, stroke, and even death, and each of these with each symptom with its own treatment. I found little research on the combined effects of long-term misdiagnosis of atrial fibrillation in a holistic view. What I do have is first-hand knowledge. There's a roller coaster physical and mental effect of being diagnosed with anxiety, not being able to mentally, physically, or spiritually bring that under control, when all along they were just symptoms of an underlying condition. Ambiguous medical answers about my struggles with being able to recall, where at times I even wondered if I might have Alzheimer's, when again it was nothing more than a condition, a symptom of an underlying condition. My body constantly fatigued, trying to go to the gym to get stronger, only to spend the next 2 weeks in the hospital with a condition called rhabdomyolysis that breaks down muscle tissue and releases creatinine into the kidneys that can cause kidney failure, typically associated with extreme muscle trauma, all from a simple 70% 5x5 workout. Feeling 10 years older, my hair turning prematurely gray, damage to my kidneys, falling asleep when I drive, forgetting what I'm talking about mid-sentence, putting my college degree on hold because I can't remember what I read or what I write. And recovery is just beginning. I'm still waiting on the CPAP to treat my apnea. I used to abhor the thought of ever having to wear a device like that, but now I wished it was already here. Putting it all together has been difficult, but knowing that this information may help you or help somebody that you know, or maybe somebody that you may come to know in the future, has made it worth it. Hopefully, all of this is just mindless information, but maybe for you it's not. At least now, you're more informed about some of the symptoms and long-term effects of atrial fibrillation.